These are my note cards. My name is Collier, and this is my demonstration speech. Would you know what to do if you discovered your mother or father lying face down on the kitchen floor? If you answered no to this question, then you aren't alone. Many Americans do not know how to perform CPR or cardiopulmonary resuscitation. According to the American Heart Association, 75 to 80% of all cardiac arrests occur at home. Therefore, knowing CPR could mean the difference in life or death of a loved one. I'm going to show you how to effectively administer CPR so that you will not know what to do if you are ever in a situation where this is needed. Suppose you do walk in your kitchen and you find your mom lying face down on the kitchen floor. The first thing you're going to do is you're going to roll her over onto her back, as long as you don't suspect a head, neck, or back injury, because you don't want to cause further damage to the spinal cord. So you're going to just roll them over on their back. Okay. Also, if you were to happen to find them on a bed or couch or any other soft surface, you'll want to move them to the floor where it's hard in order to effectively administer your chest compressions. So once you've rolled them on their back, they're on a hard surface, you're going to need to check and see if they're responsive. You're going to do this by just giving them a firm shake and saying, "Are you okay?" If they don't respond, you're going to need to ask somebody to notify 911. If you're home alone, then you need to go and get the phone, dial 911, and return to the victim. Now you need to assess the victim. You need to determine if they are breathing or if they have a heartbeat. You can do this by looking at their chest and seeing if it rises or falls. If you don't see that, then you can also bend down and place your cheek by their nose or mouth and see if you feel air. Then, after you've determined that they are not breathing, you're going to need to make sure that their airway is open. You're going to do this by what they call the head tilt chin lift method. You're going to place the palm of your hand on their forehead, 2 fingers under their chin. You're going to press up with the palm of your hand and bring the chin up with your fingers. This opens up the airway. Then you're going to plug their nose, open their mouth, and you're going to give 2 strong, even, continuous breaths. And when you do that, you need to make sure that the chest rises and falls. If the chest does not rise and fall when you give your breaths, then either the airway is obstructed or you haven't tilted your head back far enough, and you can just reposition the victim by just lowering their head again and then trying the head tilt chin lift again, giving your 2 breaths and seeing if it goes in. Then you're going to need to assess the victim to see if they have a heartbeat. You can do this by placing 2 fingers on either side of the neck, and you are just going to press lightly, and you should feel just a slight tap or thud against your finger. If you don't feel anything, another place that you can check for a pulse is in the wrist area, and it's the same side as the thumb, right below the wrist, and again, just 2 fingers lightly, and you should feel just a gentle tap or thud. After you have determined that the victim is not breathing and they do not have a pulse, then you're ready to begin chest compressions. And according to the American Heart Association 2005 guidelines, they recommend that you do 30 compressions to 2 breaths. You'll need to place the heel of your hand in the center of the chest, approximately at the nipple line. Then with your other hand, you'll lock your fingers in, lock your elbows, and when you give your compressions, you're going to push down approximately 1.5 to 2 inches on the chest. And you want to use your weight to kind of lean over the victim to push down instead of your arms. This will help you not to tire out as easily because you're using your weight to push down instead of your strength. Okay, now you're ready to administer 30 chest compressions just like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Then you're going to want to give 2 breaths. And again, you're going to use the head tilt chin lift method I showed you earlier. Heel of your hand on the forehead, 2 fingers under the chin, tilt the head back, plug the nose, and give 2 breaths. Again, you'll need to watch the chest. Make sure that it rises and falls whenever you give your breaths. You want to make sure that you're getting your breaths in because that's how the victim is going to receive oxygen. You will then continue the cycle of 30 compressions to 2 breaths until help arrives. If you are not home alone and you have somebody that's able to help you, what you'll want to do is you'll want to have one person on this side of the victim at the chest area, the other person on the opposite side at the head. The person at the chest will do 30 compressions. The person at the head will give 2 breaths. You'll repeat this cycle 5 times or for approximately 2 minutes. Then you'll switch. The person that was doing the compressions will move up and do the breaths. The person that was doing the breaths will now do the compressions. This helps the person not to get too tired. You will continue the 30 to 2 compressions to breaths until help arrives. I have showed you how to assess a potential victim and how to perform CPR effectively with a partner and on your own. Now you'll be able to administer CPR if ever needed and hopefully save a life that might otherwise have been lost.